welcome to the Integrative Medicine Podcast. I'm Dr. Jordan Robertson. In this podcast, the best of both worlds of medicine come together, informing you of your healthcare options. This podcast is for the ultra-discerning, highly critical, and results-oriented health consumer, filtering out the good, the bad, and the real ugly when it comes to health information. As your host, my mission is to help you navigate the world of evidence-based integrative care and confidently make choices to help you live your best life. Enjoy! Welcome to our 17th episode of the Integrative Medicine Podcast. I'm your host, Dr. Jordan Robertson. Today, I had the pleasure of interviewing such an impressive person, Dr. Mark Fontes. He's a naturopathic doctor who I originally became interested in after listening to him speak at an association conference on pediatric oncology and the quite extensive relationship that he has developed with sick kids over the years, specifically working conjunctively with oncologists there on how to help support pediatric patients as they embark on their cancer care. We cover a lot of bases in this particular episode, but our goal really is to help patients understand how to have a productive conversation with their oncologist about naturopathic care. And interesting, after reflecting back on the episode, I actually think there's quite a bit to be learned there about how to look for an appropriate integrative practitioner as part of your cancer care as well. We talk quite a bit throughout the show on how evidence-based practice really should be informing what we do with patients who are undergoing conventional cancer care. And we both are such a proponent of patients seeking additional support, but also being able to be well enough to do the cancer care that has been prescribed by their conventional oncology team. We dive deep into some of the challenges that we face as integrative practitioners, and we try and give patients some language for how to discuss these concepts with their oncologist, but also I think you probably could use these same tactics in looking for integrative support and the kind of practitioner that you want to work with. Mark's clinical practice is based out of Toronto at Insight Naturopathic Clinic, and we'll put the information and links to his private naturopathic practice in the show notes. He also currently is the chair of the Canadian Association of Naturopathic Doctors and is a board-certified naturopathic doctor with additional training in oncology, and is a member of the Fellow of the American Board of Naturopathic Oncology. So it's a FABNO. It's called Designation of Naturopathic Doctors, which means he's invested quite a bit of time in his training, specifically looking at adjunctive naturopathic care. So we're going to dive right into the episode. I hope you enjoy it. I personally really enjoyed having such a good conversation with an equally matched evidence-based naturopathic doctor who really is doing such great work for his patients. Enjoy. Okay, Mark, thank you so much for being here today. Can you, just to get started, I'd love if you could give our listeners a bit of a background. Why is this such a personal interest for you? How did you come to working almost exclusively in cancer care?
It was two main events that came together over the course of a couple of years. And when I was in high school, my grandfather got ill with colon cancer. And I remember being there in the hospital room with him, and he was halfway through his chemotherapy treatment at the time. And they came in and they, put that tray of food in front of him. And he was feeling really nauseous. He was bloated and, losing weight. And I remember like macaroni and cheese with like this high fructose apple juice and a brownie, I remember. And even just the look of that made him really nauseous. And I remember thinking at the time, we're missing something here. And so fast forward a couple of years when I was down at university at McMaster and doing some work with Toronto Western Hospital and volunteering there. And I got a chance to be in the oncology ward and speaking with the oncologist there. And again, just reiterated that importance of with what they do, of course, being life-saving, but that there's another piece to patient care that I always felt like was missing again in conversations with them. And then I met a colleague who had applied to CCNM at the Canadian College of Naturopathic Medicine. And from there, just really set the path towards integrating naturopathic medicine into an oncology setting.
Okay, so it sounds like it was a bit of that sort of like personal experience, and then combined with, so what was it that you were seeing during your time when you were at the Toronto General? Like, you were saying that obviously the oncology care itself was life-saving, but you said you felt like there were some gaps. Like, what do you mean by that?
The commonality of side effects that patients would describe, because I would go around and talk with them and provide them what they needed at the time, and they would mention, I'm feeling nauseous or muscle pain, and then hearing the oncologist speak about, we're hearing a common side effect of low magnesium levels in some patients, or we're noticing that the medications we're prescribing aren't really helping in regards to the nausea side of things, and not hearing as much around in a conversation around the nutrition aspect and what can be done that way, and definitely seeing how to connect it back, how it helped my grandfather when he went through his treatments, and seeing that it's not really very complicated. A lot of things that can be done here, but a lot of it is just, I think, around awareness and maybe not having enough time to go over these things, and so it really underpinned the importance of getting down to good basic nutrition advice sometimes for these patients undergoing these pretty harsh treatments.
That's so interesting. So I actually also have a personal cancer care or cancer story with how I got interested in naturopathic medicine during my last year of naturopathic medical school. My grandfather also was diagnosed with cancer, and that was part of my decision-making process to not go to medical school and to go to naturopathic medical school, even though he very much wanted me to become a doctor. We found after he had passed that he actually had kept a journal of his constipation. And towards the end, it was like 10, 15, 20 days without a bowel movement. And he journaled it, but he had never shared it with anyone, right? He didn't share with his family, and he certainly didn't share it with his doctor. But in his journal, it was like describing very closely like how much of an impact that even just that simple sort of side effect, we'll call it, to his care, how impactful that was on his well-being. And it wasn't something that was ever addressed. And so that's so interesting, because I had that sort of very, very similar experience. So, I mean, you came from like a very evidence-based background, right? Doing science at Mac. So how do you pair that now with your experience working in sort of integrative medicine? So tell me about how important that is to you.
Oh, incredibly important. And acknowledging that obviously we attempt to incorporate the highest quality evidence that we can. But there's limitations, of course, that it tends to be a large focus from a research perspective on the most common cancer cell types and very specific situations, such as the most common chemotherapy treatments that might be utilized. When you see a patient with a less common type of cancer, and now they're maybe on their second, third, fourth line of treatment, then it gets really difficult to find out solid evidence in that setting. So when I'm sitting with a patient, I sometimes will say things like, my job here to you is to provide you with information to put together a plan that makes sense for you and why you're in here to see me today. That will consist of literature that's out there that we know is really well founded and has multiple studies, and we're quite confident on its effects. It'll also consist of, admittedly, research that may only have cell line or animal studies, but the results appear quite promising. And it's important to share that with you. And then lastly, I'll speak about treatments, therapies that other patients have utilized that may not have any evidence out there, but it's helped people. And I view it as our job to share that information with you, and again, create a plan from all of those options that are out there.
So it sounds like part of your role then is just around like education for patients on what some of their options are. What else do you view that role as? Like, because, I think even in my experience working with cancer care, patients can feel quite like they're not that autonomous, right, in their journey, because they're finding things out quickly. They're getting signed up for treatments quite quickly and sort of being swept along, but don't really feel like they have a lot of power, control, or autonomy like over that whole process.
Yeah.
Can you speak to that a little bit? Like, what role do you feel like you're playing with them, like during that whole process for them?
I think a big role I try to play with patients is to allow them to feel like they are in a decision-making process, and that the decisions they are making in conjunction with their medical team are the right ones. So because some patients do leave some visits feeling, from one day to the next, or they're starting a new treatment, they're getting an IV treatment or whatever the decision might be, but to really explain to them, this is why you're being told to do this. And here are some stats that we know. Here's the treatment effect that we know. And many times I'll speak about other patient experiences, which really, really helps them. I just saw someone last week who went through this protocol for the 6 rounds of chemotherapy. Here's how their experience was. Now, of course, everyone is individual, but it's I think humanizes the whole experience a little bit more, makes them not feel alone. And something I've started in our clinic over the last couple of years is connecting patients one to another. So I always ask patients, would it be helpful if you speak to someone who's been through a similar protocol in regards to the conventional treatment? And I now have a sort of a small roster of patients who are amazing, and they're always willing to speak to new patients about, here's how my experience was. And the patient feedback from that has been really, really positive. So I always mention that as an option to new patients who are just feeling scared about going forward.
Mm-hmm. That's amazing. That's even just that sense of like community and feeling, like you said, like that they're not alone in that whole process. It's interesting. We find, similar, we don't have this formal plan in place like that. But we do find that when patients end up either IVing together or doing things where there is that community aspect, that they have that sense of like, community, and that they're not sort of forging this whole thing alone, and especially doing more integrative care where that might not be considered to be mainstream, or perhaps they're doing it as a like adjunctive care to what they've been recommended by their oncologist. That whole community piece makes such a huge difference. Are patients ever surprised about the role that you can play? Like, do you find, like, just as far as like what people think they're coming to you for versus what role we can play, how do you communicate that to patients and let them know like what your role is?
Absolutely. Yeah. One of my favorite parts in our consults, and our visits are 2 hours with patients in a cancer care setting to allow for all this to take place. And in the beginning, I'll ask, their expectations for the visit, why they decided to book in, what they're hoping to get out of the visit. And at the end, I'll always come back to that. And a lot of times we do get that feedback from patients around, I really thought I was coming in here and to get supplements. And that's always really sort of maybe expecting from this. It's what I've heard about some NDs. And I'll get feedback that I didn't expect to have so much of a conversation around the conventional treatment aspect, and to really make me feel more empowered in my decision-making, what to sort of expect from the medications, what not to expect, and to break down ideas of what they thought it could have been like undergoing certain treatment options. So in addition to providing that knowledge and support, definitely the mental emotional support that we provide as naturopathic doctors, have had patients comment on that when they get to the end of the visit, I didn't expect for us to also speak as much around my emotions around this whole experience. And it's an incredibly important part to the whole experience, is that the fear, the questions, the anger, the anxiety around the experience that they're about to have, and to just speak about that, and where can they find some solid aspects in their life to reduce some of those very strong emotions they're experiencing. And of course, we know that can have a direct positive benefit in regards to not just their experience through the treatment, but also actually have a positive impact on their overall outcome through treatment.
That's amazing. That's such a great way to put it. I think when I outline it for patients, I talk about sort of 3 areas, and maybe there's not just 3 areas, but I sort of mentioned that one of our roles is to help prevent side effects, but also we have the potential to help certain treatments work better. And sometimes that's just around compliance, right? So things like tamoxifen, we know that patients' compliance, or maybe their ability to sort of follow through with their treatment for breast cancer, is low. And so part of my role I see there is side effect management, but also helping their medication work better, whatever that is. That the middle sort of area that I think we can have a big role in, and this is what you just kind of alluded to, is all of the like residual areas of their health that are not like under the spotlight of oncology that still have a really profound impact on how they fare,
Right.
whether that's their mood or their insomnia or, their body composition or some of the things that maybe aren't being addressed by their oncologist or oncology team, but that still have a really profound impact on their prognosis and their, success through their treatment. And then the third area are sort of those, and this is probably what gets the most press, is the like actual anti-cancer agents that exist in integrative medicine. And patients are often surprised that I spend the least amount of time discussing those things, right? Because I think when we look at it from that evidence perspective, we certainly have such a big role, especially when patients are in active care. We have such a huge role to play, like in those other two areas of their health, that the yes or no to things like turmeric and things that maybe have shown some evidence in a mouse or in a petri dish. I'm spending maybe the least amount of time. Can you comment on what that looks like in your practice?
Yeah, absolutely. You hit some really important points there around the other aspects of benefit we can provide to patients during their treatment. Definitely around, they've now chosen to do whatever chemotherapy regimen, and let's say it's a setting where the outcome is very, very positive, what they're choosing to do. Then a large focus there is around supporting them through that treatment in minimizing treatment-related side effects. And in a patient on active treatment, definitely the conversation is different than someone who is now post-treatment and in a prevention of recurrence setting, or someone who's just heading into surgery before for any further subsequent treatment. The way I view it is that the nothing will provide as much of an anti-cancer benefit in that moment as the treatment they're undergoing, right? Whatever chemotherapy agent that they're receiving. And so let's ensure that your body tolerates that the best way possible. And that is an outcome that you never have to miss a treatment or it's ever delayed.
Right. Yes.
And that's where a big strong point of ours is.
Yeah, that's such a great point. And that's one of our treatment goals as well. So helping patients stay well enough to complete their prescribed care, right?
Right, exactly.
So one of the sort of most important things I wanted us to discuss today, and because you have like a unique relationship with oncologists, you have spent some time working with sick kids. Like as far as naturopathic doctors go, I think you've built so many bridges with practicing oncologists. And what I wanted listeners to get out of this particular episode was partly around like how to have a productive conversation with their oncologist about integrative care. So can you just tell us a little bit about those relationships that you have first before I sort of ask you a couple of specific questions?
Yeah, of course. And I'll trace this back to probably the first child I saw with cancer back in 2010. And it was really her parents that really pushed for the integration in regards to sick kids specifically. And so from that led to me having a conversation with the oncologist. And thankfully, they've been very open and receptive to that conversation and to really learn more and how we can fit in regards to the patient care. So I think that as a keynote there, that we come very much from that integrative standpoint and use words like that, using words like integrative and adjunctive and supportive care to already imply the message that we're trying to provide to patients and to the families and to the oncology team, that we're here to improve the patient experience as much as possible. And through that communication, to share literature and share what's out there. And, I'll always say that these aren't necessarily naturopathic doctors researching these treatments. It's medical doctors, it's other researchers out there, it's physiologists looking at these options, and we are fortunate enough as naturopathic doctors to then provide patients with those options. So whenever there's something new that's coming out, or specific research in a cancer setting, I'll share that literature with the oncology team and just start to slowly build that awareness around that. Number one, there is literature. There are groups out there in the world looking at these nutrients, supplements, etc., in a pediatric cancer setting, and that importantly, that there can be a positive outcome in the incorporation of these therapies.
Amazing. And I think that's one of the things that impressed me the most about you. I remember when we first met, it was when I was an audience member in a lecture that you gave for our provincial convention. And I remember sort of sitting, listening to the lecture, listening with maybe half an ear, as we all do in lectures. And I remember maybe 2 minutes in going, well, wait a minute, who is this? And I was so impressed with the style of communication that you had, not only with the oncologist, but also with our colleagues, around the importance of having such a strong evidence base for the kinds of treatments that you are prescribing, and being so confident to share that with the oncology team. Can you just let our listeners know, so if patients are sitting at home thinking, okay, well, maybe I do want to see a naturopathic doctor, I don't think my oncologist is open to it, right? And that's a very common sort of statement that we'll hear in clinic, even though we have such great relationships with oncologists, that patients are often fearful or have concern about sharing the other parts of their health team with their oncologist. How can patients start to have that conversation? So I'll ask it from the patient side first, and I'll ask it from the practitioner side in a second. What can patients do to bridge that conversation with their oncologists, to have a productive conversation about it?
Yeah, it's a good question. The way I've now approached it, if I use sick kids as a more specific example, I'll speak to them from both sides. So with the oncologist, but then also with the patient. So if we look at the patient specifically, I think in hearing, being fortunate now to hear the patient experience, but also the oncologist side of things, how they hear that message.
Yeah. I
think what's important is that they are still the leaders in their care, and that from a patient saying that what I'm looking for is this. They're looking for more targeted, specific nutritional advice, or they know that certain nutrient deficiencies can happen with a child undergoing conventional treatment, or there could be other supportive care options for the management of the side effects they're experiencing. So in the communication, let's say to their oncologist specifically as to what they are looking for, and that importantly, that whoever they choose to work with, that they will be in communication with the oncologist and lay out the treatment plan. We know that there are statistics out there that depending on the study, 70 to 90% of children with cancer are taking some form of nutritional supplement, but less than half of oncologists are aware of what they are taking. So there's this huge gap there. And it needs to start firstly in information sharing and communication. So I do put a big onus as well too on the treating naturopathic doctor to bridge that gap and share the information. In fact, I've been at Sick Kids for over 5 years, and about a couple years into it, I sort of informally polled the oncologists there and the nursing team there and the pharmacists who are part of the hub that I sort of go to, around feedback that they have in working with naturopathic doctors. And one important piece that they shared was, they get the release of records forms and they share it with the naturopathic doctor, but in many cases, they don't receive information back. So I think the really big onus on the patient seeing the naturopathic doctor is that naturopathic doctor takes responsibility for sharing that plan and opening up those lines of communication to state, this is what I'm prescribing, here's why, here's what the expected outcome is, here's potential side effects of the treatment options, and here's why it's safe with the prescribed treatment that the hospital has.
Mm-hmm. So it sounds like it's mostly about just communication.
Absolutely. That's
right?
Number one. Absolutely. Yeah, absolutely.
Yeah, it's just about communication. And I think communicating around expectations. So, like you kind of pointed out that what our role is and sort of, to use that phrase, staying in our lane. I think oncologists are concerned that when we're adding treatment that we're not doing it in the greater context of what their treatment plan is. So right. I remember having a conversation with an oncologist who was against patients doing IV therapy. When we had a good conversation about it, he was like, well, I don't see why, if I've prescribed 5 weeks of radiation, that there's an emergency to start IV therapy right then and there when we don't have evidence for combining the two for this particular cancer type. Why wouldn't we wait, right, until the end of the 5 weeks? And really, truthfully, they kind of had a point, right? That, every role and every practitioner has a role, and every treatment has a role, but also a life, right? Like patients aren't necessarily undergoing all aspects of their oncology plan every single day forever. I think if we all can take that step back and figure out like where we are offering the most support and when, and just having a really open conversation about that. I think if an early stage patient who maybe is going to do radiation and then never be treated again, maybe they don't need to do a lot of other treatments combined at the same time that we don't have evidence for. We probably have a different answer for a patient who's in a palliative stage 4 scenario where they likely will never discontinue their treatment, right? And so, layering on treatments that maybe have less evidence or maybe we have a clinical experience with. What do you think? Like, can you comment on that at all?
Yeah, absolutely. I'm in full agreement with you there that the uniqueness that we have to provide to every single patient case, right, and their experience. And I've had some colleagues ask around recommendations for treatment plan suggestions, and one thing I always talk about is that there's really no similar case. Sure, that the conventional treatment itself might be the same, but from the patient perspective, that's where, and their history is what will change ultimately what we do with them. So I think about an example. I think about, certain types of lymphomas, for example, can have a well over 90% chance at response to treatment and 5-year survival rate. And so if we look at, we know there's all these great recommendations we can add in 5, 6, 7, 8 things. What value does that add to the response they're going to get from their treatment already in the first place? And then, like you suggested, mentioned, with a palliative care patient or a patient who may be on now a potential clinical trial, or like a second, third, fourth line treatment option, that perhaps that's a better example where we need to look at the incorporation of some additional therapies that we can offer in order to improve their response as much as possible.
Mm-hmm, mm-hmm. Yeah, I know. And it sounds like, we do the same. I will send a letter to the patient's oncologist that is referenced, actually. So if I'm recommending something to support sleep or to support pain management, I'll include the references and look at how that combines with their chemotherapy drugs or how that combines with their particular cancer type. And I'm very frank when we maybe don't have evidence for combination with a certain medication, but, maybe we don't have evidence of harm either. And so I just share all of that information very openly with their oncology team and their pharmacist so that we're all on the same page, and that when we make suggestions or whatnot, that it's very transparent, to the very least, like what we're doing.
Absolutely.
I think that can help patients feel more comfortable and confident advocating for themselves too, because that's one of those things I think we end up being, is like a support person so that patients can advocate for options in their treatment that sort of suit their scenario best.
Absolutely. Yeah.
So one of the other things that I think, well, at least that I struggle with in practice, and I'd love to know what your take is on it. Our patients are exposed to a huge amount of information online about potential, I'll say in sort of air quotes, cancer cures. And I find this sort of one of the most challenging things we end up having to do in fielding questions about sort of unfounded claims in cancer care. I'd love to sort of hear what your thoughts are on that and how you navigate that with patients, because obviously people listening are looking for, how do they make the most informed decisions? But unless you've gone to school for critical appraisal, which we both have had the good fortune of doing, it can be tough for patients to look at a headline and know whether that's applicable to them. And of course, when they're looking for hope, right, it's easy for them to see things that are published online as in such a positive light. How do you manage that?
It is a difficult one, just because of the volume of information that's out there, and websites and experiences that can come off sounding very dramatic and positive, and so some patients are drawn towards that, and what I describe is that let's look at information, and there could be something out there more recent or new that I may have missed or not seen of late. So I'll always kind of respect that to see if there's any new evidence out there. But that first and foremost, again, let's say a patient undergoing conventional treatment at the time, that there can't be anything that really replaces the benefit of that treatment. And when we look at a suggestion that is there the potential? What's the potential benefit? And as you mentioned as well earlier, what's the potential? Is there any potential harm in doing these things? There's certain suggestions out there you come across where, when patients incorporate them, if I mentioned apricot seeds, that for some patients it can really upset their stomach and it makes their nausea worse. And that's something that you want to do while they're undergoing certain types of conventional treatments. So it's describing, the history of where some of these recommendations come from, what the evidence has been up to date, and also always sharing, other patient experiences with similar things that they have done and included from those recommendations that they come across. But again, above all is to really ensure that they feel confident and supported in decisions they have already made from the treatments that they're undergoing, as well as the other therapies that we've already discussed with them, to feel good that, you're on a good plan. We're covering the bases. I'm very confident in that. And these other therapies we're coming across online, let's say, there is not just sufficient literature to support their incorporation. And we haven't also seen benefit when other patients have decided to incorporate that into their plan as well too.
Mm-hmm. Mm-hmm. You probably say it much more eloquently and patiently than I do. I think, I try and teach patients about that sort of like hierarchy of evidence. So that certainly always brings up the question about things like, the proper term is publication bias, but the maybe more layman's term is conspiracy theory, that maybe some information just isn't available about these treatments. How do you answer that question?
With that question there, I'm not a believer in conspiracies.
Okay. Yep.
And that ultimately everyone has the patient's best interest, and if they're sort of feeling that way, then we kind of revisit their team. Well, you have your oncologist, you have your radiation oncologist or surgeon, you have your nursing team, you have whoever else from the hospital setting as part of your circle of care, and now you've included me as part of your circle of care, which is wonderful. Are you feeling like you need to add anyone else to that circle of care in order so you feel really well supported? Because in these types of settings, we're really sort of grasping at straws in some cases, and that I think we can make better choices from treatment options we've suggested. And again, coming back to the focal point of to feel empowered and positive around the plan they have in place already.
That's beautifully said. No, I think that's great, right? It's reinforcing that we're making the best decision with the best information that we have available to us in this moment. And I think you're right, like exploring why they're searching for these additional treatment options or these additional theories on their cancer type can maybe help us understand why they're not feeling that confident in their current care, and can help sort of dispel or realign like some misguided ideas or thoughts about cancer care, because we are all on the same team, right? We all just want the best outcome for them. And I think you're right, like just reframing that and trying to understand why. And I think too, like if something isn't going to cause harm, I'm very clear with patients that I don't believe that it will cause harm. If they want to eat cottage cheese with flax oil or some of these like various sort of online cancer cures. But I also want them to understand what my sort of hierarchy of treatment options is. And if we're starting to do those things at the expense of going for a walk or doing your yoga class or taking the 2 supplements that I've prescribed, then we're sort of losing the point, right? It's, if we want to layer on some sort of lesser understood or less evidence-based solutions, again, that don't cause harm, let's not let it cloud what our sort of primary goals are, right? And so also for listeners,
I was going to say thank you for mentioning that around the patient experience around all of this, that I've also had some patients describe that, those who are following, the treatment plan there at the hospital, they're doing things with us. They might be coming for IVs, let's say, and they're really quite committed. But then they mentioned how, making 10 to 12 juices in a day is incredibly stressing them out. And I remember having a patient say just that she was making so many juices that she didn't have enough time with her family and wasn't able to actually include exercise now part of her plan. Because something that she had come across online. And that's such an important piece around, what is the benefit, what's the potential harm of these treatments, but also at the cost of what else in their day, because they are, there's other things involved in their whole human experience. And it's just a really important piece to reflect on. And I'll also come back to our goals. So here's my goals as your ND. What are your goals? And then with this option that we're looking into, does that fit what we're both aiming for here?
Mm-hmm, mm-hmm. So what do you feel like the areas that we can make, like from an evidence-based perspective, like what areas of a patient's sort of cancer experience, whether it's like, particular side effects or treatment outcomes or whatnot, what do you feel like we play the biggest role in supporting? Like, what are the areas that if patients said, well, what do you think we should work on? Like, what are some things that you think that we have the greatest impact on that listeners may not be aware of?
The patients who, to kind of take a step back, I guess, patients who come in just prior to their conventional treatment, I feel very excited about those patients from the perspective that in my experience, we can have the most impact in that setting. We're talking about communication with oncologists, describing what our role is, reviewing the evidence that is out there. And so when we have that little bit of extra time, it allows us then to more properly build those relationships and get a solid plan in place in advance of conventional treatment options. So that could be, a patient with breast cancer who's coming in a couple weeks prior to their lumpectomy. And after that might be radiation therapy, or a patient living with colon cancer who's about to start their 6 to 8 chemotherapy regimens the week after. I find in those cases that it's, we're starting from a place where we can build up resources to explain why they're about to undergo treatment and the benefit in doing so, where our role is going to fit in throughout their care, managing the side effects as we had touched upon, and building up that communication and network with their healthcare team. And definitely my experience, those patients do well. Not to say that other patients do not, but they do well from the sense that I think we know where their baseline is. We can run appropriate assessments and blood work where indicated, and adjust those things as they go along through treatment. So definitely a strong point I see is supporting patients through conventional treatment in the reduction of side effects and improving, various quality of life outcomes during their treatment, sleep and mood and appetite, bowel movements, etc. And the same goes, of course, for patients who are coming in the midst of treatment. It's just that we might have a little bit more of catch-up work to do from building up those relationships and seeing how they respond to the treatments that we've decided to do together.
Mm-hmm. That's such a good point. Like preventing anemia is easier than treating anemia. Preventing radiation dermatitis is easier than treating radiation dermatitis. So I totally agree with you that the earlier that patients sort of engage in that conversation, not only do we get to sort of have that entry-level conversation about their treatment plan with their oncologist, but we also get to put maybe our best foot forward, right? Because that's something that we do so well is that sort of preventative aspect versus trying to dig patients out of a deep hole when they're, 8 or 9 treatments in and their blood work is suffering and they are suffering. So I agree with you. I think the other area that I thought that we did such a great job at over the course of a patient's entire process is helping support patients with body composition. So whether that's patients that would benefit from weight management prior to, say, lumpectomy, or in palliative cancer, I think the evidence we have for supporting patients from losing cancer-related weight or cachexia is quite strong. And I think we can play a huge role in how patients fare through their palliative care because of the impact we can have on body composition. And that's not just about appetite improvement, although that does make a big difference. But the tools that we have, like from a nutrition and supplement perspective, I think we have a big role to play there. Would you add anything else to that list?
No, I think that's exactly it. Right there is yes, supporting patients in advance of treatment, and then again, even if they are coming to see us, because sometimes they find out about us into their experience, right? And that's completely fine, of course, and we can get them out of those deep holes that they might be in. It's just that it's going to take maybe perhaps sometimes a few more recommendations or a little bit more time to get that treatment outcome, but we definitely know we can achieve just that.
Yeah. So what would be your takeaway message for patients that are listening who maybe either have been diagnosed with cancer or undergoing care, and tell our listeners how they can get in touch with you personally, like as far as your clinic, and tell us a little bit about more about your practice?
Sure. So I think the takeaway message is to include, of course, a naturopathic doctor into your healthcare team, and that we are part of a puzzle that the patient builds, and that we help you in building to see what other aspects of their journey that they require, and look for a naturopathic doctor who does have that experience and can communicate and work with the oncologist team, because I'm, as you know, Jordan, a huge proponent of that, and it's a piece that has to be there in regards to their care. Patients feel more empowered, they feel listened to, and they feel much more supported when they know everyone's part of their healthcare experience. In regards to my practice, I practice in Midtown Toronto in the Least Side area at Eglinton and Bayview at Insight Naturopathic Clinic. So patients can always visit our website, insightnaturopathic.com, and reach out to me at mark@insightnaturopathic.com. We are a cancer-focused practice. And an additional part of that practice for me is in seeing children with cancer from Sick Kids Hospital and working with oncologists there. And we've been fortunate to work with oncologists in a variety of hospitals in the Toronto area.
Amazing. And we'll put the links to your practice and contact information in the show notes, so you can link right from the episode notes to Mark's practice, which is in Toronto. Thank you so much for being on the show today, Mark. I feel like you are modeling such amazing practice when it comes to what we want to see from naturopathic medicine in Ontario and in Canada, and that sort of like truly integrative approach in healthcare, and how patients can access that as they undergo their cancer care. Because like you said, we know that patients are looking for integrative support during their care, but it's bridging that gap between, or teaching patients basically where the expertise lies and how we can be a role in their sort of whole process. I very much appreciate what you're doing for our profession, but your patients also are so grateful to have you on their team to be that person for them. So thank you so much for being with us today.
Thank you. And thank you for having me, Jordan, and for all the work that you do through your education. And I've heard Jordan speak as well, too, at a couple of conferences, and sharing your great information. And in doing this podcast, it's such a great resource for patients and the profession.
This concludes our episode of the Integrative Medicine Podcast. As I strive to bring you the tools and advice you need to make well-educated healthcare choices, I hope you listen along. Questions about the podcast or topic requests can be forwarded to our email at imedresearchhub@gmail.com. Remember to subscribe to receive updates on the latest episodes through iTunes, Stitcher, or Google Play.